Everyone hear me? Cool. So today's session is about consent, and I think this is quite an important one because it talks a lot about respect as medical professionals, as well as being people that care about other people. You should always respect what other people have to say about their own lives. And as we know, this relates to the autonomy pillar in medical ethics. So without further ado, let's start on our talk about consent. As always, feel free to put any questions or any suggestions in the chat, and I will get back to them as soon as possible, as soon as I've read them. Right, so today's session is about consent. Sorry, so what is consent? Consent is defined as the permission given for something to happen. In medicine, and in most cases actually, there are two types of consent. There is implied consent, where this is the type of consent that is not implicitly given by a patient, but it's more assumed due to the circumstances that have led to the activity possibly needing consent. And although that's quite wordy, the way to break it down would simply be to say something like, when a doctor is taking a patient's family history, the fact that they have turned up for the appointment and the fact that they are talking about the family history implies that they've given consent, or by the fact that they filled in the form to talk about family history implies that they've given consent for the doctor to know about this family history, which is implied consent. The next type of consent is informed consent, and informed consent is the more explicit one, where people specifically say or sign a form or in some way or another say that, yes, I give consent for a specific thing to happen, which is in certain places such as procedures, medical procedures or whatever, is very important because some people might not give that permission, and also you cannot perform such a procedure without giving this sort of consent, without having taken this sort of consent from the patient who this procedure is happening to. So who can actually give consent? And when I was researching this, actually, this was quite interesting because there were lots of things that didn't turn up, that I didn't know, and that came up, which is quite interesting. So first of all, what does the NHS say about who can give consent? So in their words, they said that people aged 16 or over are entitled to consent to their own treatment, and this can only be overruled in exceptional circumstances. Otherwise, so this basically means that normally people that are age 16 or above are entitled to consent to their own treatment. Otherwise, patients can give consent, and this is the case most times when patients give their own, parents can give consent, and when there's a child involved, that's normally the case that the child gives the consent. However, it's not always true. Medical professionals only need one parent. It's normally true that the parents give consent, but sometimes in special cases, such as Gillick competence, which we'll talk about now, it's quite possible for the child to give consent themselves. Medical professionals only need one parent to be present to give consent for a treatment. Now, you may have heard scenarios such as a mother and daughter present themselves at the doctor's office or whatever, something like that. Basically, that's talking about how if a child is present, and if one parent is present, they just need that one parent's consent. Legally, by law, they only require one parent's consent for a treatment, which is quite important because it might not always be possible to contact both parents. There are exceptions, of course, and if a parent refuses treatment for their child, which could save their lives, then the court can overrule this decision, but this is in few cases, and we will look at this later on. In emergency situations, it is possible for healthcare professionals to perform the treatment without actually asking or looking for parental consent, because if waiting for parental consent is going to put the patient's lives in danger, then they are better off, then they're legally allowed to go ahead with the treatment if the parent is uncontactable, if they haven't been able to gain parental consent in the time that they need to, and delaying it any longer would cause the child to suffer. So I mentioned Gillick competence, and I'm going to explain what that is now. So Gillick competence is basically the special case where a child themselves can provide consent. And there's a criteria for this, and we'll see about that. It's called capacity, and we will talk about this in the next slide. However, the main reasons why Gillick competence is brought up are when children give their own consent under 16. It is possible for them to give consent for these three reasons. So it might be because they would like therapeutic support, but prefer their parents or carers not know about it. they might be seeking confidential support for substance misuse or something like that, and they don't want to tell anyone. And that's another reason why they might go and give their own consent. And again, they'd be assessed for guilt competence. Or they have strong objections about their future living situations or their arrangements, which would be refuted by the parental carer, maybe safety-wise, and they're allowed to bring this up legally. And again, they would be tested for Gillick competence. Gillick competence, so Gillick's a special name, and competence basically means, does the person who's giving consent have the ability, mental capacity, and do they absolutely understand what they're being told? And they're tested for this. So this is how Gillick competence is assessed. So the criteria is they look for the person's age. Obviously, the closer they are to 16 means they're more likely to be able to understand the variety of information thrown at them. They need to be able to understand the issues and the disadvantages and the advantages of the issue that they're being presented with, maybe the treatment of whatever they've done to, come to the doctor's office without asking for parental consent or without a parent present, and they want to go ahead with the treatment, and they've given their own consent. They need to understand the risks and implications of what they're asking the doctors to do, which is very, very important, because doctors will look for this and medical professionals will look for this, that they truly understand what they're getting themselves into without before performing any sort of treatment. They need to be having their ability to process any information they receive assessed. So there's lots of information being thrown around in the medical world, especially when there's complicated treatments or where Gillick competence is concerned. There's lots and lots of times where everyone needs to know exactly what's happening, and it's very important for everyone to realize that whoever's in this special case, whoever's come to the doctor's office or in the medicine world or a hospital or wherever, they need to know exactly what procedure or any information that they're being given about their special case is talking about. They need to understand that, because if they don't understand it, then they can't perform it. And if you don't understand it, it also means that the person might not have the full picture and may go back on it later. So it's very important that they understand everything. Their understanding of alternative and secondary opinions. I apologize for my pronunciation, it's awful. Their understanding of alternative and secondary opinions. So secondary opinions are actually a legal right of any patient to look for a secondary opinion if they don't agree with a certain doctor. And a person might come in looking for a certain thing. A child might come in looking for a certain thing in the case of Gillick competence. But then someone might, medical professionals might recommend an alternative thing. And so the medical professionals need to see that the child understands these alternative opinions. They may not agree with them. They may not go ahead with them. However, they need to understand why they're being presented to them and what the alternative opinions talk about and why they may be might they be better. And again, they need to be able to explain every one of their decisions. And this may sound condescending to some people, but it's very, very important that anyone who's coming in the Gillick competence case is able to explain a rationale for their decisions and choices. And actually, Gillick competence in a whole is a very, it's not known by many. I know for a fact that a lot of my friends I asked about this and they said they didn't know it. So I think this is a really good topic to pick up on if you're asked on this in an interview, because it might show extra research. Right. So the NSPCC website said that consent is not valid if the child is being pressured or influenced by someone. This is obvious. I mean, if you're being pressured or influenced by someone, if the child is being pressured or influenced by someone, and I think actually in many cases adults too, if they're being pressured or influenced by someone to make a decision, that decision is not of their own accord. And if it's not of their own accord, then that consent is not valid. So when can consent actually be overruled? So the Mental Capacity Act of 2005, I put that as a note there. There's a governing body of the Mental Capacity Act of 2005, but basically mental capacity talks about the ability of a person to understand all the information objectively and then make a decision on it. Because if they can't understand all the decision, if they don't have the mental capacity to do that, then they can't be allowed to give consent or lack thereof. You need to also understand that consent could be overruled if someone refuses potentially life-saving treatments. That goes for both the parents and for the child themselves. If they, either of them, or any person in general, if anyone refuses treatment that could be potentially life-saving for that person and without it they could die, then that can be overruled by a court. And parental consent not given for LSTs. Guys, again, if you have any questions, please put them in the chat or unmute yourself and ask us. I'm guessing LSTs is one of the, oh yeah, we have a question. Yeah, exactly. And so what are LSTs? So LSTs are life-saving treatments. I don't know if that's an official abbreviation, but that's what I put. Let's carry on. So respect. Respect is obviously a big topic, and obviously you should treat everyone with respect generally, as well as in the medical field. But I'll show you what I mean when it comes to respect in the medical field, and especially in consent. So just because you as a medical professional thinks, actually, you know what, we'll start off with this. Does anyone have any idea what I might mean by respect in the medical profession? Please feel free to put ideas in the chat, and we'll talk about them right before I reveal, and then we talk about some of the official answers. Any ideas, guys? Any ideas about respect could mean? Yep, so one person said respecting patients' autonomy to make their own decision. That's a really, really good answer, because obviously that's what consent is all about, is allowing people to make their own decisions and then medical professionals respecting it. Any other ideas, guys? Absolutely any other ideas? There are no wrong ideas, and please don't feel shy to put any answers in. I will show you. Respecting colleagues in the MDT. Yeah, exactly. So colleagues, sorry, I'm not sure what you mean by MDT. But colleagues, respecting colleagues is obviously very important. Oh yeah, okay, fine, yes. Respect patient social background. Yes, so that's one of the points we're actually going to talk about now, is talking about the patient's background, and you have to respect whatever they may believe in, and that just because you don't understand it does not mean you can't respect it. You have to respect everyone around you, respecting their religion. Yeah, exactly. And even if you're not of that religion, and that's really at the core of the matter, it's not just religion, but every single thing. People have different views, and that's what makes everyone special. I know that sounds cliche, but it's true. And the fact that people have different views, we have to respect those views. May not agree with them, but you have to respect them. And this actually is one of the main arguments on the NHS website, as well as lots of other cases. So if I put the PowerPoint back up, I'll show you guys what I mean. Right, so just because you as a medical professional think someone's choice is irrational, it doesn't necessarily mean that it isn't irrational, because personal views matter. For example, I've put here, religious views and personal views matter. So, for example, I've said blood transfusion. Now, I talked about capacity earlier on, and capacity and mental capacity talk about the ability of someone to make a decision, normally pertaining to mental capacity. So just because someone says that they don't want a blood transfusion, I think someone said examples, Jehovah's Witnesses. I'm not sure if that pertains. I'm not sure what the stance is for blood transfusions in the view of a Jehovah's Witness, but again, that's a religious view that needs to be taken into account. And actually, legally, if they do not agree with something based on personal or religious views, so and you're aware of this, you get told this by the patient, this does not mean that they lack capacity to give consent. So obviously everyone needs in the medical profession, there will be lots of professionals that will assess people's ability and capacity to give consent. And if they have religious views or personal views that they don't want a certain treatment, you have to respect them, and that does not mean that they do not have capacity to give consent. However, like I've said at the bottom, someone with a diagnosed medical condition, and this could be a personal view. For example, the example is anorexia nervosa, where someone is has extreme malnutrition, and they refuse to accept treatment because they may not accept that they are anorexic, and we want to give them nutrition, or we want to give them treatment to help them as a medical professional. That would be classified as not being able to give consent and not having the capacity to give consent. Why? Because this is a diagnosed medical condition, and although it's very important for people to understand is that because it's a diagnosed medical condition, this actually affects people's capacity to make the decision. And that's why it's very important to understand for people to that have such a medical condition, that basically you're saving lives if you give them the treatment. Again, it's a very fine line, and in any case, you should always consult your supervisors or your seniors, and they will always have enough experience to guide you in this matter. But again, it's very important to respect people's views. Again, like I said, there are some certain cases and special cases. Is it the same with mental health conditions? So the mental health conditions angle, again, I'm not, I can't speak for every case because everything is on a case-by-case basis. But the NHS website does talk about the effect of shock or stress on people's decisions. And so again, a medical professional, a trained medical professional, would have to assess the ability and the capacity of someone to give consent pertaining to whatever, if they have a mental condition, a mental health condition, if they're stressed, if they're shocked, etc. But again, that can affect, I believe the NHS website did say that it can affect the capacity and ability of someone to give consent. Again, please feel free to go and research this. Or you can leave your email and we will research this and get back to you. So what if someone is incapable to give consent? So this means that if someone is not able to give consent, then basically what happens? It means that it's on you. As a medical professional, it's on you to make the decisions with the best interest of the patient in your heart. So you have to determine the best steps forward for them. However, you have to consider everything in the best interest of the patient. You have to consider firstly if you can wait until they can give consent, if that's possible. If you can wait and it's the waiting period, the delaying period does not harm the patient's health severely, and it's okay to wait and they can give consent fully, properly later on, then it's best to do that. However, it may mean that waiting period might be really dangerous at that point, so you probably shouldn't wait. Again, case-by-case basis. You should always be involving the patient as much as possible in every decision you make. Yes, it's possible that they may be incapable to give consent, but you should always be involving them. After all, you are treating them. Then you should always be taking into account, even if they have been unable to give consent, to give consent, it's very important that you take into account any views that they might have had or any objections they might have had to any course of treatment you would be offering if they were able to give consent and if they were giving active consent. It's very important that you consider what they might say. Cool. And again, if you guys have any questions, please put them in the chat. I know I'm going a bit too quick. Right, so does anyone know what I might be talking about with this picture? So it's kind of a guessing game, but why, first of all, can anyone guess what this is? And then why this may relate to consent? Anyone? Hippocratic Oath, I think someone said. The law. Yeah, I mean, what specifically do you guys think that is, the building? I'm not going to insult your intelligence. I think everyone knows it's a courthouse, I believe. So this is a court. This is basically where we're talking about the Court of Protection. The Court of the Protection is the legal body that governs the Mental Capacity Act of 2005, which we mentioned earlier. And you should, the Court of Protection comes in when you should be involving this specific court, and we'll talk about when you should be involving them and why. So you should involve them during moments of serious dispute or debate about best steps forward for an incapacitated patient. If you can't obtain consent, or they don't have a power of attorney, they don't have a person with a power of attorney, etc., etc., then you need to come up with the ideas. But if there's so much debate and so much uncertainty around it, then you should involve the Court of Protection. So they are, like I said, the legal body that oversees the Mental Capacity Act of 2005, and they are always consulted in some cases, such as sterilization, and this is more in in reproductive purposes, if people don't want to have children, you should, people say that apparently you should always consult the court of protection. Donation of organs or regenerative tissue from the person. Sorry, what did the previous slide say? It said court of protection. That's the name of the court. Cool. And then also stopping so this is quite a serious one, and it's stopping the food for someone in a continuous vegetative state of minimal consciousness. So if someone's in a coma or a vegetative state and they can't give consent, and they can't talk and they're not active, then actually there may be debate on whether people should, or whether the hospital should stop the nutrition on this person. And obviously that's a big debate, because you may be effectively you may be ending their lives. And again, the court of protection should always be consulted on this. Just going to take a moment to look at the chat now and see what everyone said. All right. For 16-year-olds, is it the parent's decision or child's? So like I said, if they're Gillett competent, and if it's in the special cases, then it's the child's decision. Normally, in a 16-year-old child, with a 16-year-old child, the parents can give, parental consent is the most often case. However, I'm not sure if they're allowed to give their own consent just naturally as an adult. But the NHS website says 16 or 17, so it's not entirely specific. But normally it's the parent giving consent, and parent or legal guardian giving consent for a 16 or 17-year-old. Does anyone have any more questions before we move on? Any questions at all? Or any suggestions or anything you want to talk about? Unmute yourself or put it in the chat. Or if no, just say no so I know. Yeah, okay, what about intersex people? Sorry, I'm not sure what you mean by intersex people. Could you just clarify? Okay, right, while that's happening, let's move on. Okay, so changing capacity. Oh, right, so their sex often gets decided by their parents. I am not sure about that case at all. I'm so sorry about this, but I don't know, and you're going to have to go research that. I'm really sorry about this. Actually, I hadn't even heard of that case before. Or I'd heard of, I don't know what to, I don't know what would be the case there. Changing capacity, LPA, legally binding decisions or living wills. Does anyone know what any of these are, first of all, before I get started? Any ideas what they might be? Any of them? Like DNR. What do you mean by like DNR? Okay. Do you know resuscitate document signed by a patient? No, I know what a DNR is, but what was the context of you asking that question? Would it, for example, sorry, let me just get that question back up. It just disappeared. Would it, for example, what medication or procedures the patient allows while he's capable? It's a legally binding decision. DNRs. So euthanasia is illegal in the UK. Again, you're going to have to research the DNR, because euthanasia is illegal in the UK. So I don't think DNRs would be, but I do believe DNRs are a legally binding decision where DNRs are viable and euthanasia is viable. But again, I'm not sure because it's illegal here. Would it, for example, what medication or procedures the patient allows while he's capable? I don't exactly understand your question, but I think you mean that, does one of these mean what the patient would want if they like medications and treatments? And so, yes, so changing capacity is the type of capacity that where people might originally be capable of giving their own consent or decisions, mental capacity. However, this capacity can change with time. So as they get older, they may have memory loss, they may have, a bunch of things can happen, and this can lead to the capacity of someone changing over time. And so lots of people decide to do to go two ways, one or two ways. So it's LPA, which is, I believe, lasting power of attorney, and or binding decisions, legally binding decisions. Sorry, I'm just going to see what the chat says. For example, patients establish their care plan when they're still in capacity for the day, when they will lose their capacity. Yes, exactly. So a legally binding decision is just that. When someone anticipates that they may be losing capacity in the future, they make a decision with a lawyer present, obviously, and this is a legally binding decision, or called a living will, where they say, right now I'm capable of giving consent, so I shall consent to these procedures in the future where I may not be capable to give consent, but as of now I am, and so I'm making this decision. LPA, or lasting power of attorney, is where they assign, normally to family member, someone who really cares about them, power of attorney. And power of attorney is when they give that person the power to make decisions on their behalf. Again, I think in the LPA case as well, if there's treatments that could potentially be life-saving for someone, the person with power of attorney refutes them. I do believe that that can lead to that there's a big debate about that, whether that can be overruled or not. But I'm not sure again about that, if it's the same thing with as it is with parental consent. All right, so that's the end of the PowerPoint, but I was meant to say one more thing, that actually in advance, people can actually say in advance that if a lasting power of attorney might say that they need this treatment or they don't need this treatment, the person who actually gave the power of attorney to someone, they actually have the ability to say to someone else if they want that treatment to happen later on or not. And so it's very important, and that's called making an advanced decision on something. Right, guys, so that's the end of my PowerPoint presentation. Does anyone have any questions? And I'm happy to answer them right now about anything we might have seen. I know I went quite fast. If you want me to repeat a few slides, I will. I'm happy to do that as well. I missed quite a lot. I'd appreciate the recording. So I'll email you about this later if you just drop your email in the chat. But at the moment, we cannot give back recordings. However, when our website will be set up, then we will be able to distribute the recordings there, and then you can get it, or at least the PowerPoint. Again, like, I'll email you and we'll talk about that. If you want, I can repeat some of the slides that you missed. Wait, do you know what slide you started on? Could you please repeat what you said about LPAs? All right, so LPAs are lasting powers of attorney. I'm just going to double check that LPAs are indeed lasting power of attorneys. Yes, it is. It's a lasting power of attorney, and lasting power of attorney is basically when they legally appoint someone, normally a family member, to be able to make their medical decisions on their behalf. So if someone anticipates that in the future they may not be able to make decisions about their medical health or mental health or whatever, and they're not able to give consent in the future about their treatments, they may want a family member who may be able to give consent in the future to make those decisions for them. So legally, they give someone the power of attorney, and they let that person legally make decisions for them. Incapable to give consent is where I arrived, nearly at the end, sorry. Okay, that's fine. I can go back. Incapable to give consent. Sorry, did that answer your question about LPAs? Whoever asked it. Kay, I believe. Yes, great. That's what we strive for. Where are we? All right, so you came in at slide 12. That's fine. So there are two types of consent. Or you know what, actually, rather than waste time for people that haven't seen it, if you guys came in late, please feel free to drop your email in the chat below, and I will get back to you with either the slides or just the information on the slides, and then you can have a read of that on the email, if that's okay. So just drop your email in the chat and I'll get back to you. Does anyone have any other questions? Okay, so just before we end, I wanted to also say that it's very important for people to realize that there's actually quite a bit of reading that's possible to be done on this. So one of the books I would recommend you read in general, actually, on medicine and the different types of books, you know, it would make for an interesting read as well as something to talk about. It's called Can You Hear Me? So Can You Hear Me is actually about a paramedic by I believe his name is Jake Jones. The author is Jake Jones, and they don't talk about consent in there. Yes, it's just come out, right? I have no clue if it just came out, but I just read it. So you know, maybe. But that would make for good reading material for anyone considering medicine. The other thing is with consent, I believe you should look into Gillick competence a bit more, because like I said, it's something that actually lots of people don't know about until they actually get into the medicinal field. And therefore it would be interesting for people to already know about this. And actually, if a question comes up about that in the interview stage, or you know, just in anywhere, it would be really good if you knew something extra, and that would give you your competitive edge. Again, if you guys have any questions, please put them on the chat. We're here until, we'll continue the call and Zoom call until 4:40. If you guys have any other questions relating to medicine that you think we can help you with, like recommendations for books or things, which I have tons of, then please let us know. I can answer them here or email you privately. How do you deal with intimate care in a care home setting? What are the rules, etc.? How do you deal with intimate care in a care home setting? What are the rules? So I actually don't know because I haven't been in a care home, but I'm pretty sure if you arranged work experience at a care home somewhere, that would help you. And actually, I do believe that that's quite a valuable experience for applying for medicine as well. So do you mind repeating legally binding decisions a bit? Okay, and I'd appreciate book references to send my email privately. Cool. Right. Sorry, do you mind repeating legally binding decisions? Yes, so legally binding decisions, or I think this is the one where, do you mean the living wills part? Yeah, okay. So the living will or the legally binding decision is where someone, let's say they're 30, okay? And at 30 years old, they're able to give consent, let's say, and they believe that in the future they can't give consent, or they won't be able to give consent in the future, maybe because they'll, you know, that their mental capacity may not be the same, or something or the other, right? They have anticipated that they won't be able to give consent in the future. So one option at this stage would be to make a lasting will. So with a lawyer or legally, you can make a decision about what you would about what treatments you would like to have and what you would give consent to in the future, but you're making the decision. So these treatments might happen much later on in the future, 10, 20 years in the future, but you're making them when you're 30 because you know at 30 years old you're able to give consent, but at 60 you may not be able to give consent. And that's what a legally binding decision is, and that's why it's called a living will, because while you're alive, you're making decisions about what you will do when you're still alive in the future, but you just won't be able to, you think you won't be able to give consent then. And then this decision is legally binding and will actually happen. Does that answer your question? I'd like some book references, please. Okay. Thank you. All right, guys. So if no one has any more questions, I'm happy to cut the call now. If you have any more questions, please let me know let me know now, and I'll do my best to answer them. But thank you guys for coming. Also, just wanted to let you know that we are in the process of making a website where all our lectures will be available, as well as sorry, do you have a website set up for recordings? Not yet, that's what I'm saying. So we are in the process of building a website where we're going to have lots of all the lectures up, book references up, and you know, lots of things up, as well as premium content that we haven't actually delivered. There'll be like videos about helping you with different stages, which I think is pretty cool. And then you guys can contact us there as well. I'd appreciate book references. Yeah, that's fine. Sorry, there's someone. Oh yeah, so LBD is kind of similar to opting in for organ donation. I guess I'm not sure about that. So I hesitate to say yes or no in that question at all, because organ donation is completely different kettle of fish. In organ donation, organ donation, people can opt out or opt in depending on the country. And I do believe you can opt out again or opt in again. However, well, I guess in some respects, but again, I'm not sure how to answer that question without, truthfully and completely honestly. I'd say because it doesn't affect the care plan of patient care, right? No. So I would say because, what do you mean? Oh, as the organ donation, I would say because it doesn't affect the care plan or patient care, right? Actually, I'm not sure if in organ donation. So I know in organ donation you can opt in or opt out, and there are different systems. In legally binding decisions, I'm not actually sure if you can stop a legally binding decisions later on. So I guess in that respect, maybe it's not the same. Again, that's something to look into. But I guess if the person didn't want to change the legally binding decision in the future, then maybe it's similar. But again, I'm not sure. Oh yes, so quite a few people have asked for certificates, and I don't think we can give out certificates. But we're trying to contact some people who'll be able to help us in telling us if legally those certificates would hold any merit. But guys, thank you very much for coming, everyone. I hope to see you next week. Again, I'll send the link on the email or on the email. Also, feel free to follow us at the Medical Debate on Instagram, and that's also where we put lots and lots of new content, and we talk about where we put up the links to the next events. So thank you everyone for coming, and we hope to see you soon. Bye.